afternoon, guys. Conscious Caracal or Adams Vansel here. And I just wanted to talk about an article that I read this morning about that seems to be indicating that the president of South Africa, Cyril Ramaphosa, and his administration aren't taking the advice of experts, contrary to what his fans and supporters say about him being the president that is keeping a close relationship with the experts and following what they are saying. Okay, so the headline reads, exclusive, unscientific and nonsensical. Top scientist slams government lockdown strategy. The government's phased exit from the lockdown is nonsensical and unscientific, says one of the top scientists advising it. Dr. Glenda Gray, a member of the Ministerial Advisory Committee, the MAC, and chairperson of the South African Medical Research Council, said that the lockdown should be eradicated completely, and that non-pharmaceutical interventions such as hand washing, wearing masks, social distancing, and prohibitions on gatherings should be in place. So you can see why I'm bringing attention to this article, seeing as it is a very significant and serious departure from the official government narrative praising the lockdown and saying that the president and his administration have been listening to the experts, as this article now demonstrates. That does not seem to be the case. So let's see what the article says further. According to Dr. Gray, malnutrition cases were being seen in hospitals. The month-to-month phasing out of the lockdown has no basis in science, and many of the lockdown regulations were seemingly thumb sucks. So this is very heavy stuff, and it actually sounds a lot like what I've been saying for the past few weeks, and that is if you look at what the government has been implementing regarding this lockdown, you get the impression that they're just throwing darts at a dartboard to decide what the next phase of the lockdown will entail, or what the next regulation that they want to introduce is going to be. And here the experts seem to be saying the same. So the article continues, the government needed to reflect on its decisions and admit it had made mistakes because the nature of the pandemic was always changing, she said. You also have to be nimble enough. You have to either balance saving your face or saving your country, and which is more important. Gray is a specialist pediatrician and HIV vaccine researcher. She received South Africa's highest honor, the Order of Mapungubwe, and was named one of Time magazine's 100 most influential people in 2017. So this is definitely an expert in my book, and what she's saying here is really counter-narrative. So further down the article, Dr. Gray said the evidence behind certain lockdown regulations was uncompelling. For example, the regulation that open-toe shoes were not allowed to be sold during the lockdown. Her quote says, this strategy is not based in science and is completely unmeasured. It's almost as if someone is sucking regulations out of their thumb and implementing rubbish, quite frankly. Quite frankly indeed, Dr. Gray. Another quote says, in the face of a young population, we refuse to let people out. We make them exercise for 3 hours a day and then complain that there's congestion in this time. We punish children and kick them out of school, and we deny them education. For what? Where's the scientific evidence for that? So yeah, as you can see, very serious allegations here, but I do agree. We need to listen to the experts to take a leaf out of the ANC's own rhetorical book. So she further then goes on to say that at the beginning of the lockdown, there were a lot of reasons to back some of the aspects of it. But then she concludes by saying, but the de-escalation month on month to various levels is nonsensical and unscientific. So what she's talking about here, if you are an international listener, is the South Africa's approach to easing the lockdown, where we go through phases. So we started in phase 5, which is the strictest lockdown. Then we are now currently in phase 4. So questions have also been raised about whether the government is listening to expert advice of the MAC's scientists. The MAC's overall chairperson, Professor Salim Abdul Karim, said it was not true that the government had ignored advice on the issue. So there's the counter point. Another member, Associate Professor at the Clinical HIV Research Unit at Wits University and CEO of the Right to Care, Dr. Ian San, said that the committee was not asked whether the lockdown should downgrade to level 3 or any broader questions relating to the issue. So here you see Dr. Gray questions why the government appeared to be proceeding without seeking proper advice, especially regarding regulations. So here, I think, is the bombshell quote of the entire article. We believe as scientists that we can give and are giving the government good advice, and why they decided not to take advice or engage readily with the scientists is unknown. Why have experts if you don't really care about what they think? No, I mean, that is a pretty serious condemnation of the government, if you ask me. She then continues by giving her perspective in terms of what needs to be done, by saying, with increasing knowledge of the virus, we now know that those most vulnerable are the elderly and those with comorbidities. However, people under 30 and school-going children are not, says Dr. Gray. So then you deal with those people. You don't put the whole country into lockdown because you don't know how to deal with the elderly and the people who have vulnerabilities. South Africans bought in and everyone tightened their belts and took the lockdown with grace. During that period, we failed to deliver water, we failed to deliver food parcels, and we failed to make households on the brink of devastation safe. How can you continue to implement these restrictive levels when the data shows that the transmission of the virus will continue unless you implement non-pharmaceutical interventions to slow the transmission down or get a vaccine? We know what we have to do. We have to implement NPIs. I think the government has failed to understand the psyche of its populace. So this is interesting that she mentions the South African psyche, or the psyche of the populace, seeing as this is very similar to a tweet I made after Ramaphosa's speech this week, in which I observed that it doesn't seem that the ANC understands basic psychology. You can't just keep asking South Africans for more and more sacrifices and to carry a larger and a larger burden, thanking them every time for their perseverance and their patience, only then to every time just extend the lockdown and put more burdens on them. So what the ANC is basically saying is, thank you for your patience and your perseverance, and as a reward, South Africa, here are more burdens and sacrifices and costs you need to carry. Sounds like a pretty abusive relationship, if you ask me. So that Dr. San that we mentioned earlier said that the extended lockdown was having a negative impact on the healthcare system. He added that the normal, non-COVID related diseases were not receiving attention. Maternity screenings are also being affected, possibly leading to an increase in maternal and early childhood related illnesses. Hospital admissions had declined by 75% in the private sector, although the same data was not available for the public sector hospitals. So further down the article, MAC member Professor Mark Mendelson, who is the head of infectious diseases and HIV medicine at Groote Schuur Hospital, is also of the belief that phasing out the lockdown is not a science-led approach. He said that it was based on the experience of other countries attempting to flatten the curve, but the thinking still posed problems, adding that only countries which successfully flattened the curve through lockdown were those who were able to swiftly test, trace, and quarantine on a mass scale. And then he is quoted as saying, that has not been possible in South Africa, despite predictions of up to 36,000 tests per day by the end of April that have not manifested. The only way to reduce the rate of infection is through interventions such as societal distancing, hand washing, mask wearing, and cough etiquette. Infections are inevitable. 60% or so of our country will become infected over the next 2 years, but limiting the rate of infection is not going to come through lockdown. He suggested a rapid de-escalation of the lockdown to level 1. So here you have another expert saying that extending the lockdown and not loosening restrictions is not going to help. And he even suggests de-escalating the lockdown to level 1. So it does seem that the pressure is starting to build now on the ANC to either choose between, like was said earlier in this article, to sit between saving face and saving the country. And I think this is what's being communicated here. Keeping the economy shut down is like walking through a snowstorm. The longer you go on, the more of your limbs start getting frostbite and start getting to a point where they're not going to be able to be revived. While the central questions the government is asking are about balancing the impact of the lockdown with the rate of infections, Mendelson said that he believes the evidence they are basing their assumptions on is wrong. Lockdown in its current form is doing more harm than good, and given the resource constraints of the country, we need to refocus the central tenet of prevention on the non-therapeutic interventions already described, while opening up the economy quicker. So a Department of Health spokesperson said that the MAC had provided advice on the lockdown and that it had achieved its objective, and further extension of the lockdown beyond the 5 weeks was unlikely to produce any further reduction in the spread of the infection. The argument that there is very good evidence about the measures to be taken and we should simply follow such a path is simply inaccurate, Maja said, adding that the government takes the advice of the MAC seriously. The responsibility for implementation is government, not the MAC. Hence, we simply can't implement the advice of the MAC without interrogating the matter as government, since we are ultimately responsible and accountable. If my legitimacy and my reputation were on the line, as you say here, I would actually listen to the experts instead of shooting from the hip and just making things up as I go, as has been implied by the experts in this article. So while I was reading this article, I also thought about a discussion I had with my good friend Paul Maritz of the Politik podcast about this very issue. So we were talking and he remarked to me that he was looking at the policies that the ANC were following with this lockdown and he just couldn't wrap his head around them in terms of what the logic behind some of them were. And I said to him, a lot of people are trying to rationalize what they're seeing here, but they're not taking into account the ideological foundation of the ANC, which is the NDR, the National Democratic Revolution. If you don't understand the National Democratic Revolution, then you don't understand the ANC, and you'll never be able to rationalize what they are doing. Trying to rationalize what a party or a person possessed by ideology is doing would be like trying to rationalize the behavior of a psychopath. And the ANC is definitely possessed by ideology, drunk on ideology, even as my colleague Adams Ritz would say. So in order to understand the ANC and the seemingly illogical steps that it is taking, you need to understand the National Democratic Revolution, the ideology that drives everything they do. And I will be making a video on this channel about what the NDR is and what it entails and how it influences ANC policy. So keep an eye on that. But yeah, thank you much for tuning in. I thought this article was very interesting and very important, especially now in this time. So I've put the link in the description. I couldn't cover all of the content in the article, seeing as then this video would end up being like 30 minutes long. So you can go read the entire article for yourself, make up your own mind. The link is in the description. And if you are new to the channel and you liked and you found this video informative, consider subscribing below, and you can then be kept up to date when I cover more happenings here in South Africa as the lockdown progresses. I think it's very important to get the word out there in terms of the world knowing what's going on here, but also keeping the citizens of the country informed. So I will do my best there. Also leave a comment of what you thought. Leave a like if you found it informative. Really helps get the word out, because I think we need to get this this message out that the experts seem to be contradicting what we're hearing from the ANC itself. So if you know about people that might find this interesting, share it with them. Share this on social media, and let's get the word out. I think this is one of the most important articles I've read since the lockdown began. And that's why I made the video, to help inform more people about it. So in conclusion, it does seem that we are definitely led by the nose, that is. This has been Conscious Caracal. Cheers, guys. Have a good one.
Cyril, Ramaphosa, from Cape Town to Pretoria. Cyril, Ramaphosa, don't you question my authority.